The United Nations World Food Programme says there is a massive rise in the number of hungry people it plans to assist around the world as the devastating socio-economic impacts of COVID-19 pandemic push millions more people into food insecurity in low and middle income countries. To tell us more about this is Lola Castro, who's Regional Director for Southern Africa at the UN World Food and Agriculture Programme. A very good evening to you, Ms. Castro, and thank you so much for speaking to us. Now, if we were to compare pre and during COVID-19 levels of poverty and food insecurity, what are they statistics-wise?
Yeah, as you very well said, in the world we have seen a massive rise of the food insecurity related to the socioeconomic impact of COVID. Basically, the populations who were already poor in low or middle income countries and could afford a minimum diet or a food basket, now due to COVID and the impact of the joblessness, the lack of remittances, a number of factors have reduced the availability, their capacity to really buy this food basket. So what we are seeing for World Food Programme is quite dramatic, because in 2019 we managed worldwide to distribute food or cash to buy food to 97 million people. And what we are looking now is at the need to maybe have to distribute food to around 138 million people during the next 12 months. This is like an incredible amount, an incredible increase, if you want.
The WFP's Executive Director has said that food is the best vaccine under the circumstances. I mean, quite a powerful statement to make. But what do we mean here when we say that?
Basically, we know very well that people need the medical treatment. That is the first needs during COVID-19, and the prevention is extremely important. What we are doing in South Africa, to wear masks, to keep distancing, all that, wash hands, is extremely important. But we know that people require to eat every day, and if we don't feed the people, they become very vulnerable, and that vulnerability makes them fall sick more frequently. And this is why he said, anything without food, it doesn't have any effect in the populations. So we see the situation of the people getting worse and worse when they are unable to acquire the right food. The nutrition, the children under 5, the elderly, the people affected by HIV/AIDS, those are the most vulnerable people that we have around in Southern Africa, for example.
And just talk to us about the effects of increasing food insecurity and poverty beyond migration. What are the fallout of this situation?
Yeah, look, I zoom in Southern Africa. As I'm the Regional Director for the SABC region for World Food Programme, let me tell you, what we have seen in this region is the following. We have seen that already we have a lot of climatic shocks. Climate change has bring us in this region droughts and floods and cyclones, who bring a lot of people in the verge of hunger many years. Like last year, for example, we saw how Mozambique, Zimbabwe, Malawi, Comoros needed immediate relief because we had these huge cyclones, Idai and Kenneth. Also, we saw in other countries like southern Mozambique, southern Madagascar, parts of Zambia, parts of Angola, Namibia, the drought brought a lot of people that couldn't have a harvest. The animals started dying. There was really an impact. People cannot produce their food or even get money to buy their food. So in Southern Africa, last year alone, we distributed either food or cash transfers to 17 million people. But now what we are looking at in 2020, 2021 is that although the harvest is better, the effects of COVID, especially in urban areas where people could not work every day and have money to access this food, go to a supermarket or to the informal market, now we have seen a huge increment. We are talking about between 45 to 52 million people in the whole SADC region affected this year for food insecurity. We hope to be able to have the funds that we do require. We in fact require $882 million to be able to support at least the minimum, the most acute, 14 million people in this region this year.
As you said, that people who were previously immune to hunger have now been affected as a result of COVID-19. Have we seen social unrest or protests in any of these areas that you've just mentioned?
Look, what we have seen is the people unable to go out and do their jobs, and also, this region is fed mostly by small farmers, smallholder farmers, except in South Africa where we have big farmers, and also in Zambia in some areas. Most of the farmers in this region, they are small farmers, and mostly they are women, and these women require fertilizers, seeds, and credits to be able to sustain their small farms. And they also require to be able to produce and go to the markets and sell that small production they have and have the benefits to sustain their families and to feed their families, both with money and also to feed them. So by those people being now more vulnerable because of the socio-economic impact that this COVID has brought, we are having also an additional problem of reduction of food production, especially in the small farming sector. And also we have to be very careful. We have to invest a lot on those people because those are the ones who are feeding this region, but also they are the most vulnerable. And really, we need to invest on those smallholder farmers to ensure that we are feeding Southern Africa and also that we don't have more people falling in poverty faster and rapidly because of this COVID-19 crisis.
The WFP has asked for 4.8 or 9 billion US dollars in order to be able to address the situation. What about funding from governments? Is there a sustainable way that they could also help with this, or is it because we know that they're already under pressure themselves?
Yeah. Look, the 4.9 billions that WFP required or worldwide, they are really urgent because they are for the next 6 months, in fact. Yeah. Basically, this money comes from many sources. And one important source is both the governments of the countries where we have our activities and also the governments of countries that are traditional donors to the welfare program. And those traditional donors, mostly in this case, are the US, Germany, Canada, the European Union. But we also see that in Africa, we have increased amount of donations coming from the relevant countries. South Africa, for example, has been a donor to vulnerable countries in the past, and we have worked in a very nice way. South Africa contributions, we bought food in South Africa from smallholder farmers, and then we send that food to very poor children affected by HIV/AIDS, orphans and vulnerables, to Lesotho and to Eswatini. So that's a very good way of doing things. Buying locally, buying regionally, promoting the local and regional production, buying here, leaving the money here, and also supporting the vulnerable neighbors that we have around us. So that's a way to do it as well.
All right, thank you so much for speaking to us. Lola Carlos is from the UN's World Food and Agriculture Program. Lola Castro is the Regional Director for Southern Africa.